One of the first patients that I ever saw in the adult world came to me specifically because they had had such a horrific chemotherapy treatment and chemotherapy side effects from their cancer. I had a woman who suffers from breast cancer whose first round after her initial surgery was very debilitating. She was a very high functioning woman with a very important job. She needed to function efficiently. She was going through her chemotherapy. She would have to miss work because she would feel so bad. And so she was very interested in what's going on with her endocannabinoid system and what we could do to help her. She also specifically didn't have a lot of time because her next round of chemotherapy was coming up, and the card takes a while for it to come. So this is a woman in her 50-year-old range with breast cancer, very functional, successful woman who's thinking outside the box and decided to come see me. We spent a lot of time talking about what she was feeling. We spent time talking about what she needed, and really what she wanted was to be able to continue working. She wanted to be able to eat so that she had strength, and she wanted to be able to tolerate her chemotherapy that had really knocked her socks off and allowed her to just feel terrible. So about a week before, a few days after seeing her, we started her on cannabidiol because we could get it from hemp. We were able to get that going, and we were able to dose her what we thought was relatively efficient, but our goal was to get her endocannabinoid system to function better so that when she was going through her chemotherapy and her radiation, she was already having a more functioning endocannabinoid system. The great thing we had was this was almost like a placebo-controlled trial because she had already gone through this therapy, not on this, and now she was going through the same therapy with being on CBD. So we started her CBD. She went into her chemotherapy about a week or two later, and she was able to fly through her first week of chemotherapy. And the same drugs that made her feel nauseous, the same drugs that didn't let her eat, didn't faze her. She had really no problems whatsoever. She was able to fly. Part of her job was flying. She was able to not miss any days of work. And then by the time that round was done, she actually got her medical cannabis card. And at that point in time, we were 6 weeks into her therapy. She was feeling great. And now we were able to focus on her next phase of therapy. So here's an example of a patient that specifically was coming for symptom control during her chemotherapy and process for her cancer, and was able to get through that without any problems. Now, there is some data in some types of breast cancers in vivo, meaning in vitro, in a lab, where some of these types of breast cancer cells are being inhibited from growth. So part of her savviness was that she was also interested in what that can do for her cancer. We made no promises, because we can't make any promises in the scientific world right now with medical marijuana and cancer therapy, even though it's used in parts of Europe in part of their cancer therapy. But what we were able to do was at least have that as part of our goal, even though all we'll know is how her therapy goes. But she did have interest in the anti-inflammatory, anti-tumor tumorigenesis that we're learning about in medical marijuana, which was one of the major reasons why she wanted her card, so that she could theoretically add some THC to the CBD if she needed it as an anti-cancer therapy. All in all, she got through her chemotherapy. She was able to function very well. She was able to keep going through her job. And this was something that was very rewarding because this is exactly what she came for, and it was exactly the conclusions that she wanted.